As you all know, and thank you, Mr. President, it is a rare occasion when I come to the well, but I do feel compelled to let my fellow senators know my feelings on this bill. In the first week of our session last year, and my first week in the Senate, we passed a bipartisan Medicaid Financing Act which leveraged federal dollars. Without this, many of our hospitals would have closed. We turned over this responsibility to the Department of Community Health and the executive branch. Now we are proposing to reverse course on a program which also leverages federal dollars for Medicaid and turn this back over to the legislatures. And you might ask, why do the healthcare workers support Medicaid, which is the worst paying program out there? And the reason is, many of them look at it and say, we're going to be treating these people for free, and we would rather have 60 cents on the dollar than 0 cents on the dollar. Now, I fought the Affordable Care Act and believe the program as a whole is detrimental to our country. The individual mandate, which I hoped would be invalidated by the Supreme Court, was not. But President Obama has given so many waivers that for all practical purposes, it's gone. Arizona Governor Jan Brewer fought Obamacare all the way to the Supreme Court. But she has set up a program on Medicaid expansion which she states will be at no cost to the taxpayers. She also states there's a $2,000 hidden tax on families for health insurance by paying for these people for free. Pennsylvania Republican Governor Tom Corbett is using cost-sharing measures such as non-emergency use of the emergency room. Michigan Governor Rick Snyder is using an annual cost sharing of 5% and requiring health savings accounts of 2% on this population in a state entirely controlled by Republicans. Republican John Kasich, who was budget chairman in the U.S. House in 1996, wrote the budget, which for the first time produced a surplus for the U.S. since 1969. And when he left as budget chairman with a budget surplus of $269 billion, is now the governor of Ohio. A brilliant financial mind, he's looked at it and is expanding Medicaid in Ohio. He is simultaneously preparing for a tax cut for the state of Ohio. He's proposed reducing the state income tax rate to 4.88%. The Utah Republican governor says that doing nothing is not an option. By doing nothing, the combination of cuts brought about by this poor Affordable Care Act and the failure to expand means less dollars for our health care providers. To try and keep Southern Regional Hospital afloat, we have a county looking at a $50 million SPLOST, a measure that might not be necessary if they weren't treating the uninsured without compensation. Our hospitals get less money because of the Affordable Care Act without Medicaid expansion. This is why the Georgia Hospital Association, Emory Children's Hospital, and doctors groups such as the Medical Association of Georgia and our family practice physicians all support the expansion. By not expanding, we're telling them we're not going to let you get federal money for patients that you're forced to treat for free, but the state's not going to pay for it either. You have to treat them for free and figure it out. And I am very concerned that this stance is going to cause more hospitals to close. It's going to mean that Georgia will continue to share in the federal deficit, which is a problem, a deficit that in several years is probably going to require more in interest payments than we'll spend on national defense. But all the benefits are going to other states. I believe this transfer of wealth is going to hurt Georgia, as numerous studies by Kaiser, the University of Georgia, and Georgia State have pointed out. Our stance is hurting our state, but we're not lowering the federal deficit. I just don't believe that it's consistent after sending the Medicaid Financing Act last year, the Department of Community Health and the executive branch, that we now want to take control of the Medicaid expansion as we go into recess for the rest of the year without a single hearing on Medicaid expansion over the last 2 years. We've looked at a lot of bills, move over from the right lane, ambulance chasing. I think the House even had one legalizing African pygmy hedgehogs as pets. And yet we haven't had a single hearing on this issue. And I've studied it over the last year. I've met with state officials. I've gone over the numbers, which I believe to be correct, have not gotten pushback on those numbers. I encourage my fellow senators to look at the numbers. For those who say the federal government may break their promise, they're correct. So why don't we all turn down the $20 billion we're getting from them right now, including Medicaid dollars that are only paying 66 cents on the dollar. I am concerned that my party is going to lose thousands of healthcare workers and independent voters over this. The majority of Georgians do oppose Obamacare, but 6 out of 10 Georgians believe we should expand Medicaid. There is a difference between the two. I do want to add, too, that this has nothing to do with the hospital I'm at. My hospital treats the elderly. It's Medicare dollars. The bill we passed last year cost my hospital money. This is not a personal issue with my hospital. You know, I could talk a lot about prisons, health homes, behavioral health, things we could do, but I do want to leave time for others. If there's no questions, I'll leave the well.
Chair, there's a couple of questions. Chair, recognize Senator from the 34th for a question.
Thank you, Mr. President. Will the senator yield?
I'll yield.
Senator, would you repeat what you said about Southern Regional?
My understanding is that the county is looking at a SPLOST to try to help keep it afloat because they're treating indigent patients for free. And I'm concerned that we're not giving them an alternative. I don't like the Affordable Care Act, but I am concerned about our hospitals.
Senator, further yield?
I'll yield.
Senator, would you agree with me that you've been the first person to make real sense here today? This is the most important thing we can deal with today, and you are truly talking about lives. Would you agree with me?
I guess this is the point I'm supposed to say. I'm sure the senator knows of which he speaks, but I'd like to move on.
Thank you, Senator.
Thank you.
Chair, recognize Senator from the 22nd.
Thank you, Mr. President. Does the senator yield?
I'll yield.
Senator, I don't know whether to shout hallelujah or what, but I got a question here for you. Is it not true that you indicated in your comments that Arizona has in fact expanded Medicaid and it is no state expense to the general fund?
That's correct. The program that Jan Brewer set up after fighting Obamacare, as I had all the way to the Supreme Court, the hospitals are matching the dollars because they would rather get some money for treating the uninsured than no money.
The senator, further yield.
I'll yield.
Senator, is it not true that Arizona in fact voted twice to expand Medicaid?
I'm sure the senator knows his subject.
Does further yield?
I'll yield.
Is it further not true that Governor Brewer made a decision to keep Arizona's dollars in Arizona by expanding Medicaid?
Governor Brewer stated that she was concerned that there would be a transfer of wealth to California and other states surrounding.
So is it further not true then that if Georgia expanded Medicaid, we would keep our taxpaying dollars in our state at no expense to the general fund?
I think that's a discussion that should be had.
Thank you, Senator.
Chair, recognize Senator from the 2nd.
Gentleman will, do you yield?
I'll yield.
How many Georgians would take advantage, how many Georgians that are uninsured currently that could take advantage of the Medicaid expansion?
The number that I've seen is 650,000.
Do the senator further yield?
I'll yield.
What does that mean for the hundreds of rural and urban hospitals in this great state?
I think there's concern about our hospitals, and particularly in the rural areas, and I think this should be studied.
Does the senator further yield?
I'll yield.
Do you think there's a correlation between accepting Medicaid expansion and accepting and deepening our harbors?
And accepting, I didn't hear the last.
Deepen our Georgia harbors, the port?
I don't see a correlation there. No, I don't. I'm sorry.
Thank you, sir.
I'll yield the well, I'd rather.
Yeah, Senator has yielded the well.